Hello, and welcome to our first episode of our heart health class. This episode is going to be over the introduction as well as some about emergency response. This is presented by the Abilene-Taylor County Public Health District. Throughout this series, we're going to be going over a lot of different topics. Some of the topics that we're going to be going over is exercise, substance use, eating and nutrition, blood pressure, mental health, and cholesterol. And of course, we're going to be going over some other topics as well that relate back to heart health. So, whenever you're setting any sort of goal for your heart health, it is best to start with small and more long term changes. And everyone is going to have a healthy heart in their own way. So, with the goals that we make, we want to make sure that we're looking at all aspects of our health and how all those different aspects of our health impact our heart health. Starting off with some definitions. So, heart disease. It's a term that a lot of us may be somewhat familiar with, which is partly due to the fact that 1 out of 5 Americans die from some form of heart disease. Heart disease is kind of just a catch all term for many different types of heart related illnesses. The most common type of heart disease in Americans is coronary. This causes blocks in the arteries. And this is the type of heart disease that we're most likely talking about because this is the one that comes with a lot of the risk factors that we're going to be discussing ways to prevent. And then heart attacks. So, a heart attack is whenever the flow of oxygen rich blood through the heart arteries is blocked in some way. And whenever that is blocked and there is no more oxygen rich blood going to the heart, parts of a heart start to die. About 805,000 people in the United States have a heart attack every single year. That is equal to about a heart attack every 40 seconds. So, as we can see, both heart attacks and heart disease are very common in our population. However, there is a lot of ways to help prevent our hearts from having heart disease or having heart attacks. On to the signs of a heart attack, because there's a lot of different signs of a heart attack. Some of the more commonly known signs may be things such as chest pain or discomfort, as well as pain or discomfort spreading throughout the upper body. So it does not mean that the pain should only be on one side of your chest at all. This type of pain can actually come from shoulders, the back, essentially anywhere in your upper body region, or sometimes your abdomen. Another sign is cold sweat, fatigue, heartburn, indigestion, lightheadedness, dizziness, nausea or vomiting, shortness of breath, loss of consciousness, and rapid or irregular heartbeat. So there is a lot of different signs of a heart attack, and it is important to be aware of these different signs. These signs may come hours, days, or week prior to actually having the heart attack, or it could be happening during the heart attack. So if you're having multiple of those symptoms and you're especially at risk of a heart attack, it is very important that if you suspect you or someone else is having a heart attack, to get emergency care immediately. One type of warning sign is called angina. This is a type of chest pressure or pain that is continuous and does not go away with rest or with nitroglycerin. This is a very common warning sign for having a heart attack. And then silent heart attacks. So, silent heart attacks isn't the medical term. It's just what we call heart attacks that oftentimes have no symptoms, little symptoms, or overlooked symptoms. So, some overlooked symptoms would be things like the indigestion, cold sweat, nausea, and more. Symptoms that we typically don't really associate with heart attacks as much, but can just be as indicative of having a heart attack as things like chest pain. And silent heart attacks are just as deadly as non silent heart attacks. Just because someone might not realize they're having a heart attack, it can be just as deadly. And it's important to know that about 1 in 5 heart attacks are silent. So this means that a decent portion of heart attacks may have no symptoms, little symptoms, or the overlooked symptoms that we discussed. So it's very important to be aware of signs of heart attack as well as be aware of your risk factors for having any sort of heart related medical emergency or condition. Then onto strokes. So a stroke is whenever something blocks oxygenated blood from entering parts of your brain. There are 2 different types of strokes someone can have. One type of stroke is called an ischemic stroke, which pretty much just means that there is a blocked blood vessel. So think things like those arteries becoming stopped up. That can be a blocked blood vessel. A hemorrhagic stroke is whenever there is a broken blood vessel. Some symptoms of stroke is numbness in the face, arms, or legs, and that can be typically one half of the face, or one or both of your arms or legs, or a whole half of your body, as well as sudden confusion. So, an example of this might be not being able to remember where you are or how old you are, typically very basic information. This might also seem like they're not able to keep up with what's happening in the conversation or not being able to answer the questions that you're asking. Some of the stroke symptoms is having difficulty understanding others' speech, as well as having trouble speaking. So someone seems very confused about what other people are talking about and they can't seem to get words out, as well as dizziness, having severe headaches, having trouble seeing out of one or both of eyes, as well as having trouble walking. So these are all symptoms the person having a stroke may experience more than someone who's externally seeing these symptoms. The best way for others to realize someone is having a stroke is called FAST. So FAST stands for face, arms, speech, and time. Face refers to whenever only half of the face is moving. So if someone smiles or if they only have one, so if someone smiles or expresses some other emotion, it looks like their face is drooping to one side, or that only one side of their face can kind of make that expression while the other side of their face isn't responding. And arms. So if one or both sides are drooping downwards. Think if someone is trying to reach for something, but their arms just keep on falling down, they're not able to keep their arms up whatsoever. Then speech. So this is whenever words are slurred or they're not understandable. They're not talking like they normally do, and it's really hard to understand what exactly they're trying to tell you. Whether it's confusing or the words just are illegible, this is a sign of a stroke. And then time. Time is of the essence. Strokes can be very deadly, so it's important to call 911 immediately. As well as, if possible, try and mentally keep count of what time it is at that point. Because strokes are so deadly, it can be very helpful for the emergency responders to know what time the stroke symptoms first started. And then a bit on to the emergency response. This is not an official training, it's just an overview of what you should probably do if someone is experiencing one of these types of medical emergencies. It is very important to get official trainings on these, especially if you or someone else is at risk or if you want to be prepared for if anyone ever has this type of emergency around you. Starting off, calling 911. So the instant that you notice any signs of a heart attack or stroke, call 911 first. Do that before you perform any sort of first aid if possible. Calling 911 is going to get those professionals who are trained there and who have medication and tools to be able to help. So immediately do your best to tell someone else or to call 911 yourself. Starting off with heart attack. So of course, calling 911 first. However, some general approaches is after you have called 911 and if they have directed you and okayed you to do so, taking an aspirin. If you do this, you would only want to take a pure aspirin, and the 911 operator should tell you whether it should be 160 to 325 milligrams. Typically, they say to chew and swallow it. However, of course, only do it as directed by a 911 operator, as they're going to be the one who connects you to the emergency response team and will be the one who is trained on how to approach the situation the best. Another thing to do is to use an automated external defibrillator, also known as an AED device. So these are typically used if someone is having a heart attack. You want to make sure that the person who is receiving the AED, so the person having the heart attack, is not on any sort of conductive surface. That means nothing metal whatsoever. The AED device through each step on how to use it. It also may be helpful to have a 911 operator still on call with you while you're doing this. The next step is to take nitroglycerin. So you should only take nitroglycerin if you have been prescribed and to take it as directed. This will be something that you'll know how to take and when to take with a conversation with your doctor. Another approach is to do CPR. So if the person is unconscious or you do not feel pulse, it can be very helpful to do CPR. However, you should only do CPR if you're trained and confident in how to perform it. 911 can also help you with directing how to do something called chest compressions, which is not the same thing as CPR, but it can help while emergency responders are getting there. Then on to strokes. So, of course, make sure that you do call 911 first. With both strokes and heart attacks, you want those emergency responders on the scene as fast as possible to get that medical care. One way to help someone who is having a stroke is to loosen restrictive clothing, because this will typically help the stroke victim breathe easier if they have anything around their neck or anything that might be prohibiting or could prohibit their breathing. You also want to make sure to not pull on or strain any sort of weak limbs while you are doing this. This is very important because you don't want to potentially cause even further harm to the individual who's having a stroke by trying to help them. Another approach is to perform CPR. So, of course, you should only do it if you're trained and confident in your abilities and with the 911 operator's approval. There's also the option of doing chest compressions, in which case the 911 operator will give you approval and guide you through that process. And you should only do chest compressions if you're confident in your abilities to do so. You don't want to potentially hurt yourself while you're trying to help someone else. Another approach is to help the person lay down. So you do not want to move the individual if they have sustained any sort of damaging fall whatsoever. This is because if they have fallen and there is some serious injury there, you do not want to potentially make it even more severe by moving their position. In some cases, this can be very dangerous, and it is best to leave it up to the professionals to figure out what to do in that situation. It is best to lay the stroke victim down on their side with their head propped up. If you see here, there is a photo. It has the head tilted back, the hands supporting the head, a bent arm in order to get stability, and then a bent knee to prevent rolling over. It is also important to remember the time that the stroke occurred. This will be helpful for the emergency responders. And then on to the never do section with stroke. So if someone is having a stroke, you do not want to give them aspirin at all, which can seem a little bit confusing if you ever do confuse a heart attack and an aspirin, which is why it's also important to only ever do so with 911's approval. Aspirin can actually worsen a stroke depending on its cause, and it can make the stroke far more deadly. You don't want to potentially cause harm to yourself or others whenever you're just trying to help. As well as just leave it up to a medical professional. They are trained and they will know whether or not to administer aspirin, and ideally they should be responding as fast as possible. As well as do not eat or drink. A stroke can make it really difficult or impossible to chew or swallow. The last thing that you want while someone is having a stroke is for them to also be choking. All right, so that is all for our introduction and our emergency response section. And our next episode is going to be over the topic of diabetes and blood pressure.